Hi everyone, and welcome to chapter one. Here, I'm going to take my face off just because it's weird. Okay, so health promotion and nursing. We're talking about chapter one, so past, present, and future. So why do we focus on health promotion? Um, so, first of all, remember when this book was published in 2013, so things have changed since then. But still, this plays a big role. We are revolutionizing healthcare, right? We are focusing on preventing illness rather waiting for illness to happen and treating it. And we have come a long way even in the last 4 years. We've been doing that, and each year I think we get more and more aggressive. So local, state, national, global levels of legislation and programming. And what does that mean? So we're talking about at a local level in government, a state level, nationally, and even globally. We are looking at the way health programs are built and fixing them according to need, um, so that we can better provide care for people and ensure that the care that we're giving focuses on prevention of illness rather than waiting for illness to occur. And it's our responsibility as healthcare providers to do this because we have such a shortage for care, and we want to make sure everybody gets access as needed. And then embodies a collaborative effort. So, the whole idea of healthcare has changed from kind of this singular entity. We are now so focused on the group um, that we no longer are kind of just working individually as a hospital group. Or it's not just the doctor, right? There's so much more to healthcare, and we collaborate. We use social workers that are medically trained and behavioralists, and we have OT and PT, and we slip healthcare into our education system and education into our healthcare system, because our goal at this point now is to prevent these crazy acute issues or these chronic issues that are not only quite costly but devastating for a person. And so all of this is at the very core of nursing practice. I mean, Our Lady with the lamp was the one who kind of started this ideal of prevention. So this is a really, really great article. Um, and look at me, saving it as we speak for you guys, so I can post it onto the wall. But this talks about how, the wellness of promotion, or the future of health promotion and nursing has come together. So I just want to read a little piece on why this is just to the core of nursing, and then we'll move on. So the Future of Nursing report published by the Institute of Medicine, which we love the Institute of Medicine, in case you're wondering, symbolizes a paradigm shift in healthcare delivery from sick care to well care. Okay, so the Institute of Medicine envisions a healthcare system where nurses intentionally promote wellness and disease prevention and improve healthcare outcomes throughout the lifespan. The nursing profession is well recognized for the role of disease prevention and health promotion, as established in the seminal article of Donaldson and Crowley to the recent Future of Nursing report from IOM. And I would definitely recommend all of you guys to read it. Within the scope of nursing practice, the words health, health promotion, wellness appear to be used interchangeably. So Florence Nightingale, the original woman, and then there's Virginia Henderson and Margaret Newman, developed frameworks that conceptualize wellness. However, wellness is not clearly defined within these theories, and now we're trying to define that even more. So, and I will post this to our wall. Okay. So, moving on, defining health promotion. So health promotion themes the idea of empowerment, lifestyle, health enhancement, and well-being. So what do we mean when we talk about empowerment? So health empowerment is engaging one another in order for people to take ownership of something and do it themselves, right? So kind of like you give a man fish, he'll eat for a day. You teach a man to fish, he'll he'll eat for a lifetime. That's empowerment. And so when we talk about health promotion, we have to talk about empowerment because you spend maybe an hour with a patient, um, or 15 minutes, depending on where you work, um, on health promotion themes, but they have a lifetime in order to embody these themes. So how do we empower people? And then we talk about lifestyles. So understanding people's way of life day in and day out and how that affects their health. And what are some lifestyle changes that are that they can make? So modifiable lifestyle. And then of course, what are things that are easy for them to change? What are things that are just going to be impossible? So for example, somebody with really bad asthma, telling them to move out of the city. Well, if they only qualify for urban Section 8 housing, moving out into the country isn't realistic for them, is it? Especially if they don't have access to a car, how can they get to their job? However, you can modify things like smoking and, you know, they live in the city, but they can get their air filters cleaned. They can make sure they have their air conditioning going to keep environmental factors out. Health enhancement. So doing things to enhance your health, right? Eating more vegetables, exercising, not smoking. And then well-being, taking care of the whole person. So what are health education components? So increasing knowledge, developing skills, and changing behavior. Okay, so first things first, increasing knowledge. Oftentimes people do things out of ignorance. They don't know, right? And even in this day and age, we have so much access to healthcare information. People still aren't aware of what causes what and what you can do to make things better. So, for example, you know, we talk about sodium and how it affects our blood pressure, okay? And um, people say, oh, I don't eat a lot of salt. I don't eat a lot of salt. But some people don't understand that there's sodium in your prepackaged items, right? Um, a pack of ramen noodles has 4 grams of sodium. So if you eat that, you've eaten 2 days worth of sodium. So increasing knowledge and then developing skills. So developing skills for people to say no, developing skills for people to talk to other people so that they get what they want in a good way, developing skills for people to understand how to take their medicine or to check their own blood pressure at home, to understand how to read their blood sugar monitor. Um, that is a skill that is going to help improve health promotion. And then changing behaviors. That one's even trickier, right? You have to figure out what motivates someone to change their behavior, understanding change theory, and then understanding how to counsel someone on behavior change and how to properly counsel someone on what the right change is. You know, I had a nurse I worked with who, seriously, one of the best nurses I have ever worked with, but really wasn't up and up on teaching just general people about nutrition, right? So he was teaching everybody Atkins and the ketogenic diet, which obviously we know works. People lose weight on it. But also studies show that it's really hard to sustain. It's definitely not an easy diet to do when you're not very educated, you don't have a lot of access to certain foods. And so if you work in public health and there's people living on food stamps and you're trying to get them to avoid drive-throughs and just eat stuff with low sodium content, you're talking to them about high fat, low carb, and their education level isn't very hard, that's not really a realistic diet change, right? When we talk about nutrition. So understanding how to help people change behaviors and also how to change behaviors appropriately. So health promotion in the past. So contributions from ancient times, the times of Babylonia, Greece, and Egypt. So the Code of Hammurabi. So here's a health promotion timeline, and we are going to look at it together. So 3000 to 1150 BC. During the Minoans and Mycenaean time, it was evidence shown that these civilizations built drainage systems, toilets, and water flushing systems. And oftentimes you can track plagues and times of really bad disease to the water system. And actually, Florence Nightingale talked about clean water and sunshine and open air, and that changed the way we took care of people forever, but even in very early ancient times, so that it could keep people from dying so civilizations wouldn't die out. So here we go, talk about Smith Papyri and Code of Hammurabi. So the Smith Papyri is the oldest healthcare related written document. And within the text, it talks about surgical techniques that are described to keep things clean. The Code of Hammurabi was the earliest written record concerning public health, and it contained laws pertaining to health practices, physicians, and even fee schedules. And this is so early. So even at an early time, people were trying to organize health in a way to prevent people from dying because, whether it was about improving science and knowledge or just the fact that they're trying to keep their civilization alive. The world's first written hygienic code was formulated within the biblical book of Leviticus by Hebrews, but even historically, these writings are preserved. And it displays interest in the cleanliness of bodies, protections against the spread of contagious disease, and specific hygiene rules for menstruating women. Of course, we're not talking about like everybody living in a tent nowadays is the best way to stay clean, but they understood at a young in this time that disease was spread through bodily fluids and unhygienic practices. So then we go to 10,000 BC, smallpox versus measles. So Rhazes was the first to identify smallpox, and it was distinguished from measles and suggested that blood was the cause of infectious disease. So you might think, okay, well, who cares? But it's important to understand this because then we understood not to mix blood, right? Even just the idea of not consuming raw animal blood and not mixing, knives when you're performing surgery. So the Roman Empire, they built an extensive aqueduct system and underground sewers. And this really kind of took off in that the idea that it's not just your water system that you're drinking, but germs love to live in fecal matter and in urine, specifically fecal matter, obviously. Think about daycares when they talk about hand, foot, and mouth, or RSV. This is all coming from, obviously RSV comes from respiratory droplets, but think about hand, foot, mouth, rotavirus, that's all fecal matter, pinworms, fecal matter. And you think, oh my gosh, are like these kids in these daycares eating each other's poop? But it's the idea of not having really good hand hygiene. And then this extensive aqueduct system, stool is no longer going on the street or in the ground and then going into the groundwater and then getting into your drinking water. So and then the Romans were also the first to build hospitals and observe the effects of occupational hazards on health. So you work in the quarry all the time, you're breathing in quarry dust, that those people were having more respiratory issues. Okay, so the influence of Hippocrates. Hippocrates, hey, there's the Hippocratic Oath, right? And it's taken by health officials to this day. Now, when you're a nurse practitioner, there's not really a Hippocratic Oath, but you follow the Hippocratic Oath. Okay, first, don't do no harm. You don't stand there and take it at your graduation. It's kind of understood. And in nursing, we all kind of have an oath that we take, and it's influenced by Hippocrates. So Hippocrates was credited as the first epidemiologist. Epidemiology is the study of disease and how it starts, what's the cause, what's the number, incidence, the prevalence. And studying this and banking this data helps you understand and predict the possibility of disease. And this birthed modern medicine as well as health education. If you can predict actions that are going to lead to disease, then you can figure out what actions to avoid the disease. I mean, this sounds all simple to us, but at the time it was so marvel. So it taught that health was a balance of mind, body, and spirit. It carefully observed and recorded associations between certain diseases and factors such as geography, climate, diet, and living conditions. The Hippocratic Oath is still taken by health officials to this day. So 500 AD to 1500. So the Middle Ages. Okay, so during the Middle Ages, there was like this cleansing of modern thought because they thought it was like against God. So they got rid of all that hygiene. The idea of aqueducts went back. All the texts that were passed on from the ages were gotten rid of, and that's when we had the bubonic plague and killed almost half the globe. There was leprosy; it was virulent. And so then they kind of started from scratch and they developed leprosy hospitals. There were 1,900 leper houses and leprosia in Europe by 1200 AD. So Antoine van Leeuwenhoek, he's Dutch, and he discovered the microscope and proved that there are life forms too small for the human eye. So the idea that like, oh, this water looks clean, I can drink it, people realized like, oh my goodness, there's these teeny tiny microbes that are probably causing this disease. And of course, some of you are probably thinking, Denise, where does like cancer and COPD and obesity come into play? Remember, this is still a long time ago when the environmental factors were actually the main cause of death before you could worry about COPD and diabetes and all that stuff, which was a thing, they still had it. People often died more of disease. So again, you focused on what the acute issues are. And nowadays we have ways to help with disease. We have a lot of disease preventable vaccines, we have antivirals, we have antibiotics, which that's a whole other topic to talk about. So now we look at other ways people are get sick. Johannes Gutenberg, he invented the printing press, which allowed health literature to get distributed to larger audiences. So he wasn't necessarily a healthcare provider, but his invention is what helped health ideas spread. John Hunter was the father of modern surgery. He explored the workings of the human body. He actually figured out how to cath someone. Oops. So then the 17 and 1800s. So we'll talk about Edwin Chadwick. He published Report on an Inquiry into the Sanitary Conditions and Laboring Population of Great Britain. And he was one of the people who went into the laboring class where people were working in factories and living in row houses and workhouses and was like, oh my gosh, no wonder all these people in the working class are dying young and sick. And this was kind of that study of environmental health. The General Board of Health for England, so Chadwick's publication, the government was forced to intervene and open the General Board of Health for England. So for those who talk about Queen Victoria, this is kind of like this area where this started. Louis Pasteur, he was a French scientist and he discovered germ theory of disease. He developed a technique to pasteurize milk. He discovered how microorganisms reproduce, and he was the one who talked about like there has to be an approach to create immunizations. Dr. James Lind discovered that scurvy can be controlled by consuming citrus fruits. Edward Jenner discovered a vaccine procedure against smallpox. Smallpox had 100% mortality rate. And if it became an epidemic in your area, you can guarantee at least 40% of the population would be dead. So smallpox was bad, B-A-D. And when Edward Jenner came up with a vaccine procedure against smallpox, it changed the way civilizations survived. Dr. Jon Snow, oh my gosh, is anyone thinking Game of Thrones? He hypothesized that cholera epidemic in London was being caused by microorganisms coming from drinking water. This was huge because before it was kind of like, we knew cholera was through the water, but they didn't really understand like hand hygiene and how things were getting spread. Well, he was the one using epidemiology, following patients to figure out it was this one pump. They got rid of the pump handle, think hand hygiene, and the epidemic abated. I mean, how crazy is that? And that's all based on this whole public health study. So the 1900s to present, important establishments and acts: National Association for the Study and Prevention of Tuberculosis. So they started studying TB and how we can prevent the spread of it, learning that it happened in crowded housing. The American Cancer Society was established. Social Security Act became involved in improving health. The National Institute of Health was developed in 1930. Woohoo! 1942, the CDC and Prevention in 1946, and then the National Hospital and Survey and Construction Act, which now we know as JACO. You might get annoyed at JACO, but back then it was necessary so people didn't die of disease in a modern hospital.